Coming on the very day Ontario hits a new record high, the Ford government announces new guidelines for restrictions. In essence, they're raising the bar for when increased measures will kick in as the tug of war between health and the economy continues. The key message from the Premier: get used to living with COVID.
Are we going to live with this for a while? Yeah, I think the whole world's going to live with it for a while, at least until they come up with a vaccine.
Which means the Premier is trying to save businesses from going bankrupt in the meantime. The new reality appears to be making it easier for them to stay open. Here is the new color-coded provincial response framework that will guide decisions going forward. Green is for areas which have low COVID cases. 25 regions fall in that zone from Waterloo to Windsor. Restrictions then increase to yellow, which Durham and Halton are now in, to orange to red, which is similar to a modified stage 2, followed by gray, which is a full lockdown.
This planning framework provides structure. It will help inform decisions.
Under the new guidelines, regions like Ottawa, Peel and York Region will be coming out of the red zone this Saturday and moving into orange. That means indoor dining and gyms can resume with restrictions. Last call will be at 9 p.m., for example. Toronto will come out of red a week later at the request of Mayor John Tory. The government says it's being more transparent and is providing the assessment guidelines for each color. For example, the red zone means a region would have 10% positivity rate. Toronto's is currently 4.6. Previously, the threshold for concern was 2.5%, so the bar to impose restrictions has increased significantly. Brampton's positivity rate hit 9.6% on the weekend. As part of Peel, it is moving to the less restricted orange zone on Saturday.
Are you starting to put greater emphasis on business now than actual prevention?
Well, I'm always number one is prevention.
In the next breath, the Premier talked about restaurant owners losing their businesses.
It's heartbreaking, believe me. We're just trying to get back to as normal as we can.
The government is also releasing a new web page which the public can access so they can compare the spread by region and see what risk zone they're in.
If you're in a prevent zone with a positivity rate of 1% or 1.5, if you're in a group gathering of 20, 30, 40 people, what's your chance of coming in contact with someone who's positive, maybe asymptomatic, doesn't even know they are? What if you're in 3 to 4%, or if you're in 7 to 8%? We'll give you some information that you need to assess that situation.
There is certainly not widespread agreement on this. The head of critical care at Michael Garron Hospital, Dr. Michael Warner, says it will bring unnecessary death and illness. The Liberals call the color-coded system confusing and weak. The plan calls for testing capacity to increase to 100,000 a day. That's double. And increase contact tracing. That's critical to keeping COVID under control if restrictions are eased. Can the government do it, is the question. Now, as we mentioned, a record-breaking day here in Ontario, a new high point on this graph. 1,050 additional infections are being reported. That bumps the rolling 5-day average up to a record high of 977. Here's another alarming number. 14 additional deaths have been confirmed. That is the highest total we've seen so far during this second wave.